Hi, do you know the signs and symptoms of stroke? I'm Dr. Swathi Laroya-Kuhn, and today, as the first day of May, I'm going to be talking about the common signs and symptoms of stroke to kick off Stroke Awareness Month. We're going to be discussing the mnemonic Be Fast. You may have heard of FAST in recognition of stroke symptoms, but we're going to add the B as part of Be Fast to widen the scope and try to capture more of these strokes that sometimes do get missed in the ER. So the B in Be Fast is balance. If all of a sudden someone loses balance, feels like they're drunk walking, or that they're swaying or they're on a boat, that could be a sign of a stroke caused by a disruption of blood flow in the back of the brain. The E in Be Fast stands for eyes. If all of a sudden you lose vision, have double vision, blurred vision in one or both eyes, that could also be a sign of stroke affecting part of your brain. Usually the back again, but depending on where it is, could also be within the actual retina. The FAST in Be Fast stands for face. If all of a sudden someone's face feels heavy or they wake up feeling like it's numb, heavy, can't drink water, eat breakfast all of a sudden, stuff is kind of falling out of one side of the mouth, that is a sign of stroke. Sometimes patients may think that it's due to a stroke mimic called Bell's palsy, but Bell's palsy is caused by a viral infection. And so the treatment for stroke and Bell's palsy are going to be completely different. So please don't assume and come in right away, even if you have facial droop. The A in Be Fast stands for arms and legs. So if all of a sudden you realize that you can't raise your arm up, or you can't use it as well, or you're like dropping stuff, can't hold your cup of coffee or your pen, or all of a sudden you're dragging your leg, or it's numb and heavy, weak, that could be a sign of stroke. The S in Be Fast stands for speech. If all of a sudden our speech sounds slurred, or we can't get our words out, or if what we say just sounds like gibberish, then that could be a sign of stroke as well. I want to also add my own little caveat to Be Fast, and that's sensation. If at any time you feel like one side of your body feels heavy, numb, not necessarily weak, but numb and tingly, kind of like when you've had a dental procedure and you've had the numbing medication and it's wearing off. We've all kind of had that experience. If you feel like that anywhere in your body, that can also be a sign of stroke, as well as the speech issues. So lastly, and very importantly, T stands for time. Note the time these symptoms occurred. Note when the patient was last known well. You could be out in public. You could be at Walmart. You could be at Costco. You could be at your children's sports game and someone all of a sudden develops these symptoms. Try to take notice of the time, because that's going to really help, and that's going to guide whether the physicians in the hospital can provide life-saving treatment and reduce the disability of the patient. So that is Be Fast. Please let me know if you have any questions, but I hope after watching this video, you'll be able to better understand and recognize common signs and symptoms of stroke. Have a wonderful day.